Good morning, everyone. Dr. Eric, fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, cellular medicine, and so much more. So, doing another short video today talking about cardiovascular health as it's the number one killer of men and women. It's extremely important to be cognizant of this and its effects and how to mitigate those risks, right? And of course, as it relates to hormone therapy, there's a lot of things that we can do to offset this with proper hormone optimization and lifestyle intervention as well. And of course, as you know me, I like to bust myths and talk about this as well. And there's still a lot of contention and talk about this, especially with testosterone and estradiol. So today I'm going to talk about the vascular effects of estradiol. So everyone thinks of estrogen, but specifically estradiol, beta-17 beta estradiol, the one specific form of estrogen that is very important. And many women are aware of this, and there's still some confusion about what type of estradiol to use. And with men, there's still talk about, well, is it too high, is it too low, and this and that. So the bottom line is it's extremely important. The EPAT trial was a very foundational study that was done some time ago, and it looked at oral estradiol and how it can decrease the progression of atherosclerosis. And this is documented with a test called the CINT, the carotid intermediate thickness, where basically it's an ultrasound test looking at your arteries in your neck. And it's not your typical ultrasound. It doesn't look at flow. In other words, think of like a flow as like a tube. Is there a blockage? That's what they're typically looking for. But this is actually looking at the thickness of the media, the lining of the blood vessel, that thin little layer of cells. And you can actually pick up plaque because of that little layer, that media is getting thicker and thicker over time, or it's above a certain thickness. That can indicate that there's plaque. In other words, there's clot there, or there's plaque being atherosclerosis, which, again, cholesterol, not to get off on tangent, but it's healing itself, right? Everybody thinks that cholesterol is bad. Cholesterol is actually very good. There's usually inflammation or some type of damage, some type of insult that's damaging the vessel wall, and then the cholesterol is going in there to heal it. But over time, that inflammation is not fixed, right? It's going to continue to get worse. So the CIMT is a very cool way to pick up very early cardiovascular disease, and it's a non-invasive, easy test to do. And this showed that, again, there was decreased progression of this with proper estradiol treatment with oral estradiol. Everyone thinks, oh my God, oral estradiol. No, it's not good. Well, there's another trial, in the KEEPS trial, and they looked at pericardial adipose tissue. So the pericardium is the outside of the heart, right? And they looked at adipose or fat, and did it accumulate or not? And it correlated with coronary artery scans. Basically, this is another test a lot of people may have heard of. We're using very rapid CT scans to look at calcification in the heart, or the blood vessels of the heart. If there's calcification, that means there has been atherosclerosis, and now it's calcified, which directly is a good thing. That means it's not active clot. But if that means there's been damage, there's been atherosclerosis, and there could be worse. So you want to monitor that CAC score over time, see if it's going down, is it going up? Because if it's getting worse, now that's not good. You're getting more calcium in your arteries, meaning you're getting worsening cardiovascular disease. No, we'll not pick up soft plaque, which we'll talk about another time. That's also important. But this is a very good test. Between these two tests here, it can pick up cardiovascular disease above and beyond what we can typically do with things like stress tests. So it's correlated very, very well. The more PAT, the more calcium. Now what they found is this pericardial adipose tissue and a coronary score actually went up, got worse with transdermal estradiol, meaning estradiol creams, estradiol patches, all these different things where a lot of people think, oh, it's safe. That's the safe one. That's the good one. That's what you want because oral estrogen's bad, right? No, very safe. Oral estradiol, very safe. It actually, with transdermal, your cardiovascular risk went up. So number one killer, men and women, that risk is going up. Which one's the bad one? Transdermal. Oral, the score actually went down, so it actually protected you. Again, decreased progression. You can actually reverse plaque. It'll stabilize the plaque so it won't rupture and cause a heart attack, and it'll actually, over time, shrink and get smaller. That's amazing. Other studies have corroborated this too. So a lot of people don't know about this, that actually you can actually reverse plaque with proper oral estradiol treatment. So this pericardial adipose tissue and heart fat correlates with cardiovascular disease. So oral estradiol is not the same as Premarin and Prempra. That's where most people think of back in the day. We're thinking estrogen's bad, you're gonna get blood clots and liver problems and cancer and all this stuff. No, yeah, with the synthetic versions, yes, but the oral bioidentical estradiol, the exact kind that's made in our bodies, none of that happened, number one. So there's never shown a study where there's had blood clots. There's actually decreased risk of breast cancer, decreased risk of heart disease. And this is why: decreased progression, decreased risk of cardiovascular disease, reversal of plaque. This is pretty cool stuff. So yes, men and women. So women obviously straight up estradiol, men get that estradiol through conversion from testosterone. So that's why you do not block the conversion to estradiol. That's why you don't take anastrozole, you don't take all these things to block it. You don't want to lower your estradiol levels, because that's why these men are having heart problems and vascular problems, because they're doing that. So don't do that. So oral estradiol, extremely important. So the vascular effects of estradiol, very, very cutting edge, cool stuff. So I thought you would like that. So please like and share this post with everyone you know, especially if you know someone who's had some heart issues or family members who do the same. So if anything specifically you want to learn more, let me know. I'm doing telemedicine, I'm doing some very cool things, upgrading my platforms and my programs, doing some cutting edge cellular medicine, hormonal fitness protocols, unique and very deep dive into everything related to your metabolism, your genetics, and much more, giving you a very deep evaluation of your health, your physiologic age, and how we can better yourself. So if you're interested, reach out to me, drericprimax.com, or reach out to me below and comment below what you thought of this video. Please like and share. Everyone have an awesome day, and we'll talk to you soon. Bye.